Hello, my name is Annalie Martin, and today I will be showing you how to move a patient from the bed to the wheelchair. Now first you're going to want to evaluate their condition and their ability to follow directions and also their weight, because that will tell you how many people that you need. And that is going to, with that you're going to use the safe patient handling algorithm. So first you will instruct them to use the rail to move over onto the side closest to you. And then you also do want to remember to ask them how they're feeling and if they do have any pain. And now you can pull that rail down. And then you will instruct the patient to use their arms and legs to swing over into a sitting position. And now you're going to want to give them some time for their blood to flow and for them to regulate so that they don't get dizzy. And this would also be a great time to put on some hospital socks so that they don't slip. And then this will be where we introduce the gait belt to help the patient up. But you do also want to make sure that their feet are touching the ground. So you can ask them to move up a little bit so that their feet are touching the ground. Good time to also ask the patient if they're ready to make sure that they're not dizzy. And if at any moment the patient does get dizzy while you're lifting them up, you want to make sure to just sit them right back down. Okay. So first with the bed at the lowest setting and the wheelchair pulled up right next to the bed. And you want to check all the brakes on the bed and the wheelchair to make sure that the brakes are on. And now with your back straight and 1 foot above the other, you want to, in a rocking motion, pull that belt and ask the patient to use their body weight to help get up. So 1, 2, 3, and up. Okay, and you are going to use your legs to help support their legs, and you want to use your knee to support their weaker knee. And then you're going to prepare the patient to turn. So 1, 2, 3. Okay. And then you're going to slowly pivot backwards and tell the patient to let you know when they feel the wheelchair up against their legs. Okay, so he feels it against his legs. So holding on to the band, you are going to tell them to use their arms to feel their way to sitting on the armrest of the wheelchair. And then make sure that they're comfortable and that they're positioned okay, and also ask them if they need any help repositioning. And again, ask them if they're having any pain, and you can put a blanket on, and if they prefer, you can take off this gait belt.